ago, when the world was experiencing a pandemic, you may have constantly heard on the news that the World Health Organization had issued new recommendations on COVID. At the same time, certain fake WhatsApp messages in the name of the WHO guidelines were doing rounds. One of these involved washing vegetables with soap and leaving them in the sun for at least a day in order to eliminate any viruses that might be present in the vegetables. The World Health Organization later took it upon itself to advise the public of actual preventive measures against COVID after realizing that such incorrect information was being circulated online. So, what is the World Health Organization and how does it function? There was no single organization that oversaw global health prior to the Second World War. Only a few minor health organizations existed. But following the conclusion of the war, the United Nations was established and a health treaty was made, wherein all of these little organizations consented to merge and become the World Health Organization. The WHO is a specialized agency within the Charter of the United Nations, which is non-political in its function. It was established on 7th April 1948 by 61 governments for cooperation among themselves and with others to promote the health of all people. Following this, we celebrate World Health Day on the 7th of April every year. The WHO, with its headquarters in Geneva, Switzerland, serves as the coordinating and directing body for international health matters and public health, like during the COVID pandemic we spoke of. Among various others, the Constitution of WHO defined health as a state of complete physical, mental, and social well-being and not merely the absence of disease. Coming to the memberships in WHO, both self-governing and non-self-governing territories can be a part of it. The non-self-governing territories, if they choose to become a member, are referred to as associate members. At the time of its establishment in 1948, there were only 56 member countries. Among various other things that India did in its new year as an independent nation, becoming a part of the WHO on the 12th of January 1948 was one. Now, let's see how the WHO is structured. It has three bodies: the World Health Assembly, the Executive Board, and the Secretariat. For any decision to work, action must be taken, and for the action to work, a plan must be formulated. The Secretariat is the body that comes up with a plan for a certain decision to work. It's staffed by some 8,000 experts on a fixed-term appointment basis, working at the headquarters in the 6 regional offices. Following this plan and taking the necessary actions is the Executive Board. It's composed of 34 members, each with a term of 3 years, who are qualified in the field of health. The main board meeting is held in January every year, followed by a second shorter meeting in May immediately after the Health Assembly. The main job of this body is to execute the decisions and policies of the Health Assembly and to also advise and facilitate its work. The World Health Assembly is the supreme decision-making body for the WHO, which makes decisions based on the actions and plans described by the other two bodies. It usually has meetings at the headquarters in Geneva in May of every year. All the 193 member states will each send their respective delegates to attend this meeting. This assembly appoints the Director General, whose duties include financial planning for the organization, in addition to decision making. So, who leads this organization? Remember how we studied that the Health Assembly appoints the Director General? It is he who leads this organization for a term of 5 years. Note here that it is the Executive Board who nominates the Director General and the Health Assembly only appoints him. Looking at the regions that are marked on this global map will help you remember that there are 6 regional offices of the WHO. These are found in the African region, the American region, Southeast Asia, Europe, the Eastern Mediterranean, and the Western Pacific regions. The headquarters for the regional office in Southeast Asia is in Delhi, India. Approval of the regional committee is necessary to appoint the regional director. Now that we know the members and structure of this organization, let's understand the goals or the agenda of it. It has 2 agendas, each related to health strategies, strategic needs, and operational approaches. Under health objectives, we have promoting development and fostering health security. Strategic needs include strengthening healthcare and harnessing the evidence, information, and research. The operational approaches include enhancing participation and improving performance. Let's understand each in brief now. The WHO activities are aimed at the development of health in the poor, disadvantaged, or vulnerable groups, thus aiming at promoting the development of health of all. One of the greatest threats to international health security arises from outbreaks of emerging and epidemic diseases. Such outbreaks are fueled by factors like mismanagement of the environment, rapid urbanization, and the way antibiotics are used and misused. For this, it is extremely important to foster health security. Next, for health improvement to operate as a poverty reduction strategy, the health services must reach all the poor and underserved populations. But the health system in several parts of the world are unable to do so, thus making strengthening healthcare a high priority for the WHO. The organization also aims at making use of any available evidence, information, and research on any condition which may be considered a risk to health. The available evidence will help provide the foundation for setting priorities, defining strategies, as well as measuring the results. The WHO carries out its work by enhancing its partnership with several UN agencies as well as other international organizations, donors, the private sector, etc. This organization also believes in improving its performance by participating in ongoing reforms aimed at improving its efficiency and effectiveness, both at the international level and within countries. After having discussed so much about the WHO, by now we have a slight idea of what the work of it is exactly. Keeping in mind the example of the COVID-19 global pandemic, we know it primarily acts as the controlling and guiding authority regarding international health issues. It also works towards the prevention and control of a specific disease, COVID in this case, and then forms a comprehensive healthcare plan for it. It is the responsibility of this organization to maintain family and environmental health worldwide and to also cooperate with other organizations to implement all these in a smooth flowing fashion. Now, let's quickly go over what we have learned in this video. The World Health Organization was established on 7th April 1948 with its headquarters in Geneva, and as of 1998, it has 191 members and 2 associate members. 7th April is hence also celebrated as World Health Day. The organization comprises the World Health Assembly, the Executive Board, and the Secretariat, each having an important contribution to the body. The agenda of the WHO aims at having health objectives, setting strategic needs, as well as having standardized operational approaches. Thanks to the WHO's efforts, more people around the world are gaining access to effective healthcare. As we continue to face new challenges in public health, we can count on the World Health Organization to provide leadership and support in the fight for better health for all. For more such videos, download our app and watch videos seamlessly and learn through visually engaging mind maps. We hope we made public health dentistry slightly better for you. Please like, share, and subscribe to our channel, and see you guys in the next one.